Okay, a really short video on tobacco cessation. So, with tobacco cessation, and this is again my favorites list where I have most of the CPT bills that I bill day to day. Tobacco cessation is right here. It's 99407. And if I'm going to show you, excuse me, let me just get rid of this guy. So there's two codes. There's 99406 and there's 99407. 99406 is between 3 and 10 minutes of tobacco cessation counseling, and I'll go through a little bit more details on what is tobacco cessation counseling and how you can bill for it. And then 99407 is smoking and tobacco use cessation counseling that's greater than 10 minutes. And this is kind of really what we're looking for, because if you look at my favorites list, I only have the 99407, which you can just to search for these. Like, let's say I was trying to search for the 406, I would type it in here. It is right here. And then you can hit this favorites. You can hit this favorites thing and you can call it whatever you want. The display name doesn't have to be this long thing. It could just be whatever you want it to. But for now, I'm just going to delete that. And then go back to what you need for it. So the tobacco cessation, this is the documentation that CMS really wants in there in the note to prove that you talked to the patient about tobacco cessation. This is what they felt would be necessary to really help the patient quit smoking. So essentially, the patient's willingness to quit, what was diagnosed during counseling, the amount of time spent. So it's really important that you put how much time is spent, and also that needs to be included in your total time as well. Um, so if you do say how much time you spent with tobacco cessation, make sure you update your total time. How they've tried to quit in the past, if they have a plan, do they have a follow up with their PCP, and then what resources available, which could just be, hey, here are some numbers that you can call or people you can reach out to, or resources to help you quit. I did make a smart phrase. So if I go to my smart phrases, the one that I have is right here. It's KD tobacco cessation. You can rip this from me if you want to, or you can make your own. But essentially, it's a time component about tobacco cessation, expressing their willingness to quit, and in an attempt to quit smoking multiple times in the past. I mean, this is something that I may modify depending on patient to patient, because I can't just use the exact same thing exactly how it's worded for each patient. So I do modify it somewhat. But most patients who do smoke cigarettes have tried to quit hundreds of times in the past, which is why we know it's so difficult to quit. So it's just important that we if you tell a patient to quit smoking, it always kind of feels like a cop out, because I've had a patient just say, well, tell me something I don't know, doc. Like, telling patients to quit smoking doesn't do anything for them. They know that it's bad and they know they shouldn't do it. But what we really need to do is be giving them a plan to help them quit. Here's what we should do to help you quit. And that's what the last part of this documentation is, the formulating a plan. Could it be that it's easy to quit smoking in the hospital because you don't have your social triggers? But when you get home and you're get in your car or you're outside on your porch, and those are the social triggers that get patients to start smoking, that's the plan of how we're going to cut that down. Or if it's hanging out with people that smoke, reducing their time with them, or having them speak to those people about them quitting to smoke so they don't relapse and fall back into that same issue, and then making a follow-up with a primary care physician for continued management. um, so that's most of that is listed here. There are some methods and skills. You can write a lot of this stuff here. Here are some documentation tips, um, just so you know kind of what's in here. And then the documentation tips are, sometimes you'll see, and I'll show you through Epic, patients have a history of tobacco use or tobacco abuse, or a personal history of, if they're not actively smoking. And I'll show you some ICD-10 codes that will help. They need to have an active history of smoking, where on some of the documentation they've said that they smoke, or they've told you directly that they're currently smoking cigarettes or they're smoking cigars. So it could be nicotine dependence, that is chewing tobacco. It can be cigars or any other tobacco products. I don't think e-cigarettes count, because even though e-cigarettes are nicotine products, they're not specifically tobacco products, and that's the crux of this counseling, is tobacco. So if I'm in the EMR, if you're, let's say you're reading through the notes, and this is a test patient, so I don't have any notes here, but let's say you're reading through the note and immediately you see somewhere, either in the H&P or in some document, that the patient has a current active diagnosis of tobacco use. They told someone they smoke a certain amount of cigarettes every day and they're actively smoking. Best practice would be to go straight into your problem list and just input it right here. So, um, nicotine, you could do nicotine dependence, with current use. So you could say you add it to your problem list, and that's it. You go back to the note. You just go in there and you drop in that problem. The reason why we do this is because when you eventually go into your billing, and let's say you bill a level 3 and 99233, and you drop in all your problems for this patient, um, sorry, not nicotine. But what's going to happen is as you're looking through these problems and you're clicking and you're adding these problems, you'll see nicotine dependence here with current use. So when you see that, that's going to be your trigger to say, oh, I forgot that this patient actively smokes while I'm doing the billing. So what you'll do is you'll finish inputting the rest of your problems here. You'll hit accept. Then go to tobacco cessation more than 10 minutes, and you will just add it here. Boom, nicotine dependence with current use. And that's it. Then you hit accept. So now you have your 99233, which is your current inpatient bill for, in this particular case, a progress note. And then you also billed for tobacco cessation, and you drop that smart phrase that was in my smart phrases into your note saying that you spoke to the patient about tobacco cessation for more than 10 minutes. You counseled them on whatever it is and whatever your style is of counseling, and help them formulate a plan. And then you accept all these charges. So that's how you bill for tobacco use cessation. Some rules with the tobacco use cessation is that you can only do it once per encounter. So if someone's billing and you go back and if you click on this, it'll show you here all the charges that have been billed in the last 5 or 6 days. And if you see that someone has already billed for tobacco use cessation, you cannot bill again for tobacco use cessation. So once per encounter can it be billed, and if you bill again, it will be thrown out. But there's a lot of RVUs associated with tobacco use cessation, so that's a great method to just improve your billing, and help your patients with a real plan. All right, bye.